Good afternoon once again. I welcome you all to today's edition of Beauty for Ashes Health and Healing Fellowship. You know, our theme for this fellowship is the lump of figs. And why do we use that word? Why do we call it lump of figs? We all know in the Bible how in 2 Kings 27, how when King Hezekiah was ill, and the prophet Isaiah came and told him about that he was going to die. After Hezekiah cried out to the Lord, and he prayed and God heard him. Isaiah now came back and said, now go take a lump of figs and place on that wound that you may recover. So that's how we came about the theme for the program. But this month, we're going to be looking at women's health, everything that concerns women. Because as you're all aware, March of every month is dedicated to women. 8th of March is celebrated as the International Day for Women. So today's program, we're going to be looking at issues that concern women, especially women's health. Some of them, that doesn't mean that men do not suffer from those, some of the health issues we're going to be discussing. But like I said, this is Women's Month. So I just want to talk about women because I don't want people sending me messages, but men also suffer from XYZ. No, for this particular edition, we want to talk about women. Now I'm going to start with Proverbs 11:16-17. It says, a kind-hearted woman gains honor. Verse 17 says, those who are kind benefit themselves, but the cruel bring ruin on themselves. Proverbs 31:30-31 says, charm is deceitful and beauty is passing, but a woman that fears the Lord, she shall be praised. Then he also says, give her of the fruit of her hands and let her own works praise her in the gates. He didn't say let her beauty or let her connections, but he says let her own works praise her in the gates. So our prayer today as we start today's is that God will give each and every one of us women a heart of flesh. Remove that heart of stone where it's there. Let kindness be one of your guiding values in life. A kind-hearted woman gains honor, because we've had a whole lot of stories about women that maltreat their housemaids, the one that puts iron inside somebody's bum and all the rest of them. But we're asking today, ask God for kind heart, for that kind heart. Be a woman of kind heart. Let people know you as a person of kind heart. Being kind-hearted doesn't mean you're stupid or that you're comfortable with ineptitude or inefficiency. No, but be a person of kind heart, because you can also correct being kind-hearted. So in this International Women's Day, we're once again reiterating the fact that knowledge is power. And it is one of the best tools to empower and to equip yourself. In those days, we had women, now I'm talking about women's health. We had what we call a good and obedient patients. But you see, these days, it's becoming obvious that women are becoming aware of the need to take care of their health and their well-being. The route you choose in doing this determines what happens to you or your health at the end of the day. Now, 2 Samuel 3:33-34 says, should Abner die as a fool dies? Your hands were not bound, nor your feet put into fetters. As a man falls before wicked men, so you fell. Then all the people wept over him again. Now, there's the kind of death the Bible calls the death of a fool. There are ways that fools die. So, but what we're saying is, what we're trying to make people encourage the women. Like I said, I am talking about women today. Do not die the death of a fool. Don't die like a fool. And some of the things we are going to be looking at are the things that could actually make somebody die like a fool. So I'm going to start with what we call iatrogenic errors. Okay, these are errors caused by medical doctors or caused by hospitals. I don't want to say medical doctors because some people might feel like it's not every doctor that's killing. But I'm going to start that with, there's a research done by Dr. Barbara Statfield. Statfield is of the Johns Hopkins School of Hygiene and Public Health, published in the Journal of American Medical Association, Volume 284, July 26, 2000. why I go out of my way to ensure that sometimes I quote some of these references. I don't want anybody to quote me. It's not me that did the research. This one was done by Dr. Barbara Stafford, so you can go and check it out. It says that doctors are the third leading cause of death in the United States after cancer and heart disease. Now, this is United States. I don't know about Nigeria. We are a country that keeps, data. You know what I mean? We keep data. So if iatrogenic errors is the third leading cause of death in the United States, I don't know what it is like in Nigeria. Now, it also says that iatrogenic death toll may be equivalent to 3 jumbo jet crashes every 2 days, according to this same journal. So that means if you imagine a jumbo jet and the number of people inside and it's crashing every 2 days, it says that's the equivalent of the death toll attributed to iatrogenic errors. So you have medical errors, you have diagnostic errors, you have attentional errors, including some of those who sleep off during surgery. All those fall under iatrogenic errors. Now, the Institute of Medicine also estimates that medical errors are killing more Americans. Well, we keep saying Americans because these are the people doing more research and they have a system in place. But we are still a developing nation, and I believe God that one of these days we're going to get there. But if we're having such alarming reports coming in from America, I wonder what the situation is like in a place like Nigeria. And of course, even in the US, where some of these reports have been made, it's been met with a deafening silence. Now, imagine an airline crashing every 2 days. The aviation authorities will instantly shut down that airline, shut down everybody. Everybody that works there will just be put on hold. That's in the aviation system. But in the medical system, unfortunately, that is not so. Of course, there are preventive measures, preventive practices that we're hoping. Very simple things like even barcoding drugs to avoid mix-up. Because I'm sure some of us, we've gone to hospitals and you've been given drugs that ended up causing more problems for you. And one of the ways to avoid that is to ensure that you learn to ask questions. There's this document I keep talking about, Patient's Bill of Rights. I'm talking of those in Nigeria now. Patient's Bill of Rights is a document released by the Federal Ministry of Health and the Federal Consumer Protection Council. They have one long name now. That document is a must read and a must have for everybody. You have the right to ask questions. You have the right to know what drugs you are being given. You see, because the reality is this: when those drugs begin to react, sometimes it could be an emergency. So when a doctor gives you a medication yes, you came there for for your problem to be solved, please ask questions. Okay, this drug where they give me like this, waiting if you do for me. It's important that you ask questions. And any doctor that refuses to respond to your questions, please, I don't know whether if you report who you want to report to, whether it will even make any effect or have any impact reporting the person. Who do you want to even report to anyway? But somebody also sent me a message that one can actually go to Medical and Dental Council and report. But the reality is this: how many people have that energy to start going all that route to make such reports? So first of all, you have to be your own advocate. Your health is in your hands. Ask questions. There's nothing wrong with asking questions. Then, of course, you also need to understand that also, according to that research, that a lot of doctors are overworked. They are poorly paid. And of course, training is not adequate, amongst others. So these are the areas our policymakers need to look into in order to reduce the incidence of iatrogenic errors, because more people are dying from medical errors than the sickness itself. Then another thing I also want us to have in mind, is that allopathic medicine is excellent when it comes to acute conditions like accidents, trauma, and others. But when it comes to chronic diseases, not much is achieved in terms of cure except management. So if you are interested in managing diabetes, managing hypertension, managing all those diseases, you can go ahead and continue swallowing those drugs. But if you really, really need a cure, remember the Bible tells us in Jeremiah 33:6, I will give healing and I will give cure. So the choice is yours to believe God that there's actually a cure for those sicknesses, or you want to keep managing them. So some of the diseases I want to look at briefly on this concerning women, I want to look at cancer. Of course, that word is a word that scares everybody. Nobody wants to hear that. Some people even discussing it, scares them. But what I want to let you know this afternoon is that cancer is not a disease, as in our understanding of disease. It is your body's own cells which have assumed an abnormal function as a result of damage to their normal functioning. So cancer is a systemic condition. Your whole body is involved. Know this and know peace. And when you understand this, that your whole body is involved in cancer, then you are in a better position to make strategic decisions when it comes to your treatment. Then you also need to understand that reducing the tumor size does not equate to curing the cancer. Because a lot of times somebody might see a lump in the breast, or for whatever reasons, tumor in the colon or wherever, and they decide, okay, we want to do a biopsy. A note of caution: you as a woman, if you see a lump in your breast, take this anywhere. Don't let anybody use needle in and out of your breast. Tell them to please remove that lump. Even the one that they will open up and cut out a part of that lump to take it to the lab. Listen very well. There's nothing wrong with taking those things to the lab. In the Bible, we call it spying the land, because you need to know, okay, this lump, is it malignant or is it benign? But the manner of taking that lump can create more problems for you. So insist and beg that doctor to take out the whole lump and now send it to the lab for the test. Do not allow anybody poke needle in and out of your breast. That's a whole lot of stress on the system. Do not allow anybody open up your breast and cut out a part of that lump, leaving the remaining in there. They are creating more problems for you. If you check our previous videos, we've done some extensive discussions on that. Then in terms of your treatment, you need to also look at treatments that deal with your whole body cellular metabolism. Remember, in cancer, your whole body is involved, every organ. In fact, there's even another research that says that cancer is made up of over 200 diseases. So in dealing with cancer, you also need to understand that your whole body is involved. Don't talk about your kidney and leave your liver, or talk about your head and leave the whole body is involved. So you must look for treatments that deal with your whole body cellular metabolism. Once again, in dealing with cancer, antioxidants are vital to your life and to your recovery. Now, there are different treatments that is used conventionally for cancer. One is chemotherapy. Chemotherapy is the use of toxic drugs to kill or poison cells as they divide. The cocktails, because it's never one single drug, it's usually a cocktail of maybe 2 or 3, depending on the type of cancer they want to address. The cocktails cannot distinguish between cancer cells and normal cells. It's important you understand that. That's why some people that have taken chemotherapy, if you ask them, how are you? They can't describe how they're feeling. Some of them will tell that they feel like hell. So it's important that you make you're very, very informed before you submit yourself to that. Now, we have been told by another research by Dr. Gordon Zubrod in October 1971, this is very interesting, that few malignancies are responsive to chemo treatment. Now, all these malignancies, they are very rare in adults, according to this research. They include Burkitt's lymphoma, choriocarcinoma, acute lymphocytic leukemia, Hodgkin's disease, lymphosarcoma, embryonal testicular cancer, Wilms tumor, Ewing sarcoma, rhabdomyosarcoma, and retinoblastoma. I intentionally mentioned all of them because this list, since that 1971, it has not changed. That's why I was very intentional in mentioning their names. So when you have cancers, the common cancers like breast, colon, prostate, and somebody is bringing chemotherapy, first of all, check, is it on this list? Because whether you like it or not, chemotherapy is carcinogenic. What does that mean? It causes secondary cancer. It's not me that said it. The research is out there. Now, there's another research from the McGill Cancer Center in Canada. This is one of the best cancer centers in the world. Now, this center did a study of oncologists to determine how they will respond to a cancer diagnosis. Very interesting results. 91% of them said, 91% said that all chemotherapy programs were unacceptable to them and their family members. These are oncologists. Their reason, the drugs were ineffective and have an unacceptable degree of toxicity. Another study by Los Angeles Times found out that 75% of the oncologists stated that chemotherapy and radiation were unacceptable as treatments for themselves or their families. I rest my case there. Now, the next type of treatment we use, commonly used, radiation. Now, there are different types of radiation. There's radiation from X-rays, there's radiation from CT scans. Now, you also know that, of course, X-rays and CT scans can be life-saving, but good evidence suggests that most of the time, they are not necessary. Patients undergoing these scans are rarely informed of the risks. So you need to ask questions. This scan I'm going to do, doctor, please, what are the side effects? What are the risks involved and all that? Then, of course, there's also radiation treatment for cancer treatment. Side effects are significant and very, very harmful, because radiation also, just like chemotherapy, does not distinguish between cancer cells and normal cells. Forget that one about spot radiation. Oh, it's just a spot radiation. The bloodstream, it goes through the bloodstream and that circulates it throughout the whole body. Now, there are certain things you don't need to wait till you get there before you start doing. For instance, our soldiers who fight in the battle in war, they don't wait till they get to the battlefield before they start learning how to shoot. So for those, you never can tell, for those who may be exposed to one form of radiation or the other, ensure that you pack your system with a lot of antioxidants and nutrients from certain leafy vegetables like spinach, lemon balm, kale. In addition, of course, to some quality supplementation. This will protect you from DNA damage from these radiation sources. These ones are not negotiable. Don't let anybody carry you and be running, because you see some people in the last 1 year, they've done like 4 to 5 or 6 CT scans. Every CT scan you do is equal to one X-ray, normal X-ray that you do. And you notice that when you go to do an X-ray, the lab person who is doing that X-ray will just put you inside that room and leave you and go out. So once he's done, the machine is done, he comes back, because at that point you're on your own. He doesn't want to collect the X-rays to you because they are harmful. So those things should only be done when there is need and when it is extremely, extremely necessary. Okay, so we look at another problem. Well, do I call it a problem? No. Another issue that concerns women, like I said, men also do it: cosmetic surgery. What does the Bible say? Is there anything wrong with cosmetic surgery? Now, Esther, the book of Esther chapter 2 verse 12 says, each young woman's turn came to go into King Ahasuerus after she had completed 12 months preparation, according to the regulations for the women. For thus were the days of their preparation apportioned, 6 months with oil of myrrh, and 6 months with perfumes and preparations for beautifying women. Number one, what does this tell us? There are no quick fixes when it comes to, like maintaining your beauty, rebuilding your system, trying to lose weight, remove all those fats that is causing some form of embarrassment, and so on and so forth. There are no quick fixes. You need to give your body at least a minimum of 12 months to achieve that body you desire. So why do people rush in for cosmetic surgeries? Because they want it now. You see some people, they tell you, oh, they're planning a party, or they want to celebrate their 60th, they want to celebrate their 50th, they want to celebrate their 40th or whatever. And because of that, they feel the need to go talking a whole lot of things, talking the fat here, talking the excess flesh here and there. Okay. Now, the question is this: how many people actually have the discipline to be intentional? Because you can see in that book of Esther, those women were intentional. There are no quick fixes. You must go through that preparation for 12 months. It's very, very important. So notice that he said according to the regulations of women, not according to the regulations of men. So when it comes to beauty routines and all that, there are actually regulations for women, and of course guidelines that should be followed if you want to do those things and do it well. Then there are different types of cosmetic surgery. There's the liposuction, there's the tummy tuck. Tummy tuck is riskier than liposuction, but a lot of time in liposuction, the body fat is suctioned out through a tube to get rid of those thunder thighs, love handles, pot bellies, and other dreaded bulges. Okay, then tummy tuck, also known as abdominoplasty, is also a surgery that involves removing fat as well as this loose skin hanging over that area. Most of the time, tummy tuck is done under general anesthesia. But the question is this: do we really need to go under the knife to look beautiful? There's a whole lot of benefits, well, to those that do it. I mean, they come out looking like newborn, fat stopped in here and there. But it's also good to be aware of the side effects and complications of whichever surgery you are undergoing. In recent times, we've had a lot of news about people dying from either they died during the surgery or they died after the surgery, whichever one. But you see, like I said, we live in a place where people are not made to be accountable. Even the families of the people involved, some of them are even too ashamed to even talk about it. Some will tell you, oh, the person went in for fibroid operation, or the person went in for this. No, it's not fibroid. That person went in for cosmetic surgery most of the time. Okay, and because the families are not ready, willing to talk about these things, a lot of the doctors get away with some of the mistakes they may have made in that during that surgery. Most of the very common ones, blood clots. Blood clots can be very fatal, very, very fatal. Then, of course, individuals with undiagnosed medical conditions. Some people are hypertensive, they don't know they're hypertensive. Some people are diabetic, they have heart disease, they do not know. And they go submit themselves to these procedures and end up dying on the table. There are so many other issues that can come up. Hematoma, where a pocket of blood that resembles a large painful bruise. There are so many of them. Seroma, blood loss, infection, nerve damage. These are some of the consequences. Of course, I've talked about blood clots. I've talked about organ. There's also organ damage that could also result as a result of it. That also come up as a result of going in for cosmetic surgery. Then, of course, some people, I met a lady that did, I don't know what she did to her breast and all the rest of them. But anyway, the whole thing seemed to be popping out as if it's going to fall off. And she wasn't happy with it. But unfortunately, the amount of money needed to go and correct that surgery was even more than she spent doing that surgery. I said, well, you're your own. Then, of course, there's also the complications from anesthesia. What most people don't even understand is that anesthesia also weighs down on your immune system. So for those who are planning to go for some of these surgeries, there are things you need to do. Make sure that your, for example, tissue magnesium level is optimal. If it is not, you could die from a simple blood clot in that surgery, and a whole lot of other health health checks you need to run before going in for such a surgery. That is, if you must go in for it. Then we have another issue that concerns women, the hormone replacement therapy. Okay, a lot of women who are becoming menopausal, they decide to go do hormone replacement therapy, and that one also comes with its own consequences. Now, with a decline in your progesterone as you grow older, there's that tendency that you become estrogen dominant. But you see, the reality now is this: even with the kind of lifestyle that people are living, you don't even need to become menopausal before you suffer from what we call estrogen dominance. The wrong lifestyle, the wrong type of food we're eating, and so on and so forth, can make you become estrogen dominant. Now, we must understand that the body produces what we call natural hormones. Now, these travel through the bloodstream to fit into specific, what we call specific hormone receptor sites located throughout the brain and the body. Now, each site recognizes the specific molecular structure of a single type of hormone. Now, what happens? For the women, remember we're talking about just about women today, okay? The progesterone receptor site will not recognize estrogen or testosterone, okay? Now, there's what we call relative binding affinity. Natural hormones attached to their receptor sites, just like keys fitting into locks. So you have, when your natural hormones are depleting, there's a tendency for you to also say, okay, how do I improve on my progesterone level? There are plants that are bioidentical. There are natural hormones, natural bioidentical hormones, most of them from soya bean and from wild yam. Now, a note of caution on soya bean. A lot of the soya bean now out there is genetically modified. So if you're doing anything with soya bean, make sure that it is from the natural soya bean. So when I talk about soya bean being a good source of progesterone, I'm talking of natural soya bean. I can't guarantee the genetically modified soya bean. Then your other option is wild yam. Yorubas call it esuru. You know, when we broadcast, you see the picture of esuru. These are like two sources of natural progesterone that you can take. Now, the challenge why you need to do this is this: when your estrogen is much higher than your progesterone, it becomes difficult for you to lose weight, especially around the thighs, around the stomach, and so on and so forth. So it's important that you understand this. These are natural ways to do hormone replacement therapy, which is safe and non-invasive and not toxic. Now, a lot of times there are the synthetic hormones that is being sold everywhere. The challenge is this: for some groups of people, the people who are manufacturing this molecular structure of the natural hormones cannot be patented. Neither can the molecular structure of the bioidentical hormone. So they can't patent it. And because they can't patent it, there is no money to be made. So they will rather continue to prepare what we call the synthetic hormones. And these synthetic hormones, their molecular structures cannot be found in nature. And therefore, they produce chemical reactions in the body that is unnatural. One of the synthetic hormones that is being sold everywhere, I don't want to mention their name before they start spoiling their products. One of them is made from metabolized horse estrogen, horse as in horse of animal. Metabolized horse estrogen with a low affinity for binding with any human hormone receptor. A lot of women are taking those drugs. In fact, I know some women that are taking them, and I've tried as much as possible to tell them to get off those things. Then another hormone replacement therapy, research shows that it is 49.3% estrogen. That's another cancer-causing estrogen. So anybody taking all those synthetic hormone replacement drugs, you are doing yourself a lot of harm without knowing it. Now, there's a study by Women's Health Initiative conducted by the National Institute of Health. That study was stopped. Why was that study stopped? The synthetic hormones were found to increase breast cancer risk, heart disease, blood clots, and stroke. Then another study in this Journal of American Medical Association found increased links to Alzheimer's disease. So as you're taking those hormones, use your tongue to count your teeth. Okay. Now we look at other issues that affect women. We call them life stressors. The impact of stress on your hormone levels, your daily time management issues, how to juggle work and family. Some women are living with uncooperative spouses. Like I said, this is Women's Month. I want to talk about women. That doesn't mean that there are some men who are not living with uncooperative spouses. Some women are living with terrible uncooperative spouse, and this puts them under a lot of stress, and this affects their whole system. Then, of course, we talk about in-laws that will not mind their business. Okay, these are some of the things that create stress in the life of a woman. Then we have some women with inordinate desires and ambition trying to meet up with social media goals and all that. The things you see on social media, you think that is how it is. You see this person's marriage, you think, oh, you want your own to be like this, or this is what this person's these people's husbands are doing for them. You want your own to be like that. You are putting yourself under a lot of undue stress. Okay. Then you have other things that can cause stress, loss of job, loss of income, financial issues. Okay. Then, of course, separation or divorce. Then dealing with difficult infants or children and parents. These are some of the things that women go through. Then we also look at fibroids. One of the things, we all know what fibroid is. One of the things you need to know about fibroid is to make sure that, for women especially, you need to make sure that your liver function is maximized. Why? The liver is responsible for breaking down estrogen and other hormones. and secreting the metabolites into the large intestine for elimination. Those who consume unending doses of antibiotics, you are at risk of little or no friendly bacteria in the large intestine. Okay, so it's important that you add things like, there are foods that support liver detoxification: cauliflower, broccoli, Brussels sprouts. Now, if you can't even have access to these, there's another phytochemical, indole-3-carbinol, which supports the liver's detoxification of estrogen, because high estrogen is part of the things that leads to accumulation of, that predispose you to fibroid and associated problems. So make sure that your liver function, like I said, is maximized. It's very important. Now, a lot of times, one of the most common ways people want to deal with fibroid is by going through surgery. You must understand that if your antioxidant level is not the way it should, if you don't have the dietary discipline to stop the reason why that growth came about in the first place, you can do surgery 10 times. The fibroid will keep coming back. So cutting off the fibroid does not mean it is over, because you have not addressed the root cause why it came up in the first place. So the first treatment you need to look at in dealing with fibroid is, why did it come up in the first place? You need to look at your lifestyle. You need to look at what you're eating. You need to look at the certain deficiencies. When you have addressed that, fibroid will naturally begin to dissolve. However, if you have allowed that fibroid to grow to such a way that, when they look at it, they tell you it's like the size of a 6 or 7 months old baby, then you can actually, I will advise you, go take it out, but go to a doctor who understands what they are doing. Don't be a victim of what? Iatrogenic error. So we are in the health sector. I would say we are at the Kairos moment. Okay, Kairos is a Greek word meaning critical time, and it's sort of at that point in time when crisis and opportunity are equally balanced. Global healthcare is at the Kairos moment. Aging population in some places, high prices and all that is making people look for alternatives. So new treatments and therapies are emerging to meet the needs of our physical, mental, and spiritual health. However, the best way to avoid iatrogenic error is prevention, in spite of all the successes in global health. Now, when we talk about natural health, there's a note of caution I always want people to note. The fact that it is natural doesn't mean that it is safe. There are a lot of overhyped products on the internet that cures everything. Then again, there are also unexpected side effects from products prescribed by inexperienced practitioners. You must understand that we are unique creations. What works for one may not work for the other person. Now, as things are, you find out that there's a tendency for people to go natural. Everybody wants to go natural. In their beauty therapies, they want to be natural. Even some manufacturers of carbonated drinks, some are telling you that they're adding some natural flavors. They are the only ones that know whether they're actually adding anything natural to those flavors. But now, in the recent government-funded research in the US, 36% of adults interviewed reported using some form of complementary and alternative medicine. Now, that number rose to 62% when the use of supplements and prayers were included. And I said that in a place like Nigeria, I'm sure that the figure will be like 98% once you add prayers, because we're a people of prayers. So basically what we're encouraging our people to do is you need to look at your diet, you need to add some exercise. There's a saying before that an apple a day keeps the doctor away. Not anymore. A lot of the apples now are genetically modified. So taking an apple a day does not solve the problem. Today you need to supplement that apple. You need to supplement it with and of course your well-balanced diet is very important. Then of course also understand that nutritional supplementation is not just about health, not about treating diseases. So 3 key principles you need to understand: healthy diets, moderate exercise program, and cellular nutrition. If you have listened to some of our previous discussions, we've talked about what happens when you exercise vigorously. You release free radicals, and if your antioxidant level is not enough to mop up those free radicals, you actually expose yourself to different health risks. So it's important that you understand that. Now, there are two key nutrients I want to also talk about as it concerns your eyes. These nutrients, lutein and zeaxanthin, they are the only dietary carotenoids that accumulate in the retina, particularly the macular region. That macular region is essential for vision. It's located at the back of the eye. Now, some of the foods also you need to add to enable you keep your eyes bright. The Bible says your eye is the lamp of your body. You need to keep those eyes seeing very well. Okay, these two antioxidants, you can get them from kale, spinach, broccoli, lettuce, corn. And when I say corn, I am talking about non-GMO corn. So you need to be intentional. If possible, start planting your own corn, So because God did not leave us without protection in this world, knowing that some people are going to come in to mess up our health system or our food system. So there is need to add a lot of vitamins into your food, and as you do that, you will not have any cause to regret what you have done. So in closing, in the last episode, I had discussed about magnesium, vitamin E, and some other products. And this is where we call it a day today. So in closing, I have come to certain conclusions that no one can tell you what is right for you, your body, or for your health. So my advice is that you read, do more research, ask questions, and take strategic steps to a healthier you. When it comes to your health and your well-being, only you, guided by the manufacturer of the human body, is the final authority. God bless you.